Welcome back to the part 3 of psychoanalysis and homeopathy, psychotherapy and homeopathy. So far, in two parts, we discussed a lot about the interesting facts about how homeopathy is probably working for many people, how elemental form में वो किस तरीके से काम करती है. Somewhere in the discussion, we were at the point where we talked about the triggers, where that state, sir, you named it some miasm, what it is called?
Yeah, miasm.
Miasm, I'm sorry. Miasm. When we talk about miasm, that means there is certain causality which leads to the this side or the that side. So how can we take forward this idea of causality led approach into homeopathy?
It's a very good observation because I think miasm is the only concept which comes closer to the approach of causality in homeopathy. Homeopathy by itself is a phenomenological system. It's not a causality system,
True.
which is very different from psychoanalysis, even large parts of psychotherapy, because we are essentially a causality driven system. So let us say a patient of OCD comes in. The Freudian will immediately start thinking about the unresolved Oedipus as the cause. The Kleinian psychotherapist will start thinking about the open split as the cause. Kohut will start thinking about the fragile self as the cause. ISTDP person will start thinking about the repressed, murderous and torturous rage leading to anxiety, which is being channelized into the compulsion or the obsession or both. So different schools in psychoanalysis will start looking at causality and then tailor the healing approach based upon that causality. Contrary to this, homeopathy will be a phenomenological system, that this collection of events is seen and therefore remedy X. Now you don't go into why this collection of events has been seen in this particular individual when this remedy was given, because the why will then take us into the working of the remedy which no one knows.
True.
So it is very much like the Kohut's system. Kohut's system in psychotherapy is what we call the self-psychology, the self-psychology school, where the entire school is based upon the concept of the self without defining the self. Similarly, you don't go into deconstruction of the vital force in homeopathy. You don't go that far. You stop at the vital force. You don't get into the deconstruction of vital force, or you don't go into the ontological part of the vital force in a scientific sense. What happens is that when you have a causality based system and a phenomenologically based system, and you try to bring them together, there are inherent advantages and difficulties. What is of great interest to me is the fundamental fact of the way materials have been found to exhibit properties in homeopathy. That two important parts stand up. One, that when you potentialize something, it becomes very potent and allows us to heal. The healing potential comes up in potentialization. That is one very important fact, that materials can be potentialized and converted into healing agents. One part. The second part is the finding of these materials becomes easy because often what essence we derive out of understanding of that thing in a macro way, often the same thing is active even in the micro form. Now these two findings are very important to me, and this takes me to another aspect. Some remedies, if you look into homeopathy, you will find only one or two elements which have come up in proving. Now either that is because the proving has not been adequately done, or it may be because the remedy itself is such that it produces one or two strong but limited effects. Now, this is very important because it gives us an idea that maybe there are remedies, substances, which when potentialized may be healing only one or two of events, difficulties. And this allows us to visualize causality-based healing using homeopathy-based method. For example, if we talk of the split being open, now the split being open can lead to many difficulties which may be situated differently in different chapters of DSM. If you go into the chapter of obsession, you will find some obsession which actually is caused by the split being open. You go into the chapter of schizophrenia, you will find some hallucinations and delusions which are based upon the split being open. You go into the chapter of anxiety, you may again have anxiety of different forms coming out of split being open. You go into the chapter of personality disorders, many of them, even most of them will have the split open. So one psychoanalytic phenomena of the split open can lead to so many different difficulties which are described in different chapters of DSM. Same would be true of a repertory or materia medica, that the split being open can lead to so many different things at the phenomenological level. Now, that is being treated in homeopathy in one way. My point is, can we have a substance such that if it is potentialized, it heals the split itself?
Okay.
So you have one or maybe 10 for only the split. Let us say you discover that in different people, the same substance does not work, but we have 10 groups of people in which 10 substances work. But you are still looking at a causality-based thing to heal the split. Now, if we can find some kind of solution through potentialization, and the promise is because there are millions and billions of materials in the world. If you look at the whole world of synthetic materials that we have created, it's practically innumerable. And more we can create. And anything can be potentialized to find out if it can become a healing agent. And if we can use artificial intelligence powering it up with experience that we have till now, or maybe some other method in future which we don't know at present, to go through this multitude of materials, maybe something is found. And even if we go by the tried and tested old method of proving it on everyone and not going by computer modeling, even then, even if it takes time, if we can get something to heal Oedipus, something to heal split, something to heal the fusion individuation problem, we will be getting into a different situation altogether. And it is worth trying to find substances which are of this type. And the hope comes from many substances which produce only one or two effects in proving. So such substances already exist. It's not against some law of nature. It is just that they are rare. And rare elements have always been in the periodic table. And you can always find out substances of these rare substances, what makes them rare, and then try to create synthetic substances of that type and see if their potentialization works. So this is one very important area to explore. I don't know what will come out of it. It may be possible that it may come to nothing, but it may be possible it may come to a revolution.
It would take the mutual knowledge and information to create so, because just being an homeopath won't fix the Oedipal. And also because the Oedipal can, as you mentioned, even in the DSM, we have Oedipal related issues in most of the personality disorders, in many other disorders and clinical problems. So it is very fundamental to human nature.
Correct.
To a great extent. So addressing something until unless it becomes a big problem, nobody's going to address it.
Because it brings us to the core issue of psychoanalytic mechanisms underlying the pathology described in DSM. And
exactly.
In DSM, you may have 150 or 155 different sicknesses of the mind. But psychoanalytically, if you look at the mechanisms, there won't be more than 25. So the whole DSM will collapse into those 25 mechanisms.
Collapse into.
Just as
Absolutely.
in Ayurveda, everything has to collapse into Vat, Pitta and Kapha. Here, the entire DSM will collapse psychoanalytically into some core 15-25 mechanisms, not more. So,
Again, where your heat model can be of a great help if taken up with the knowledge and information of pranic, psychoanalysis, chakra healing, and homeopathy, and other holistic formats.
one wild idea is, can you use pranic healing to find remedies? Because the scanning
That's what my next question was about to come.
The scanning can help.
Can help.
But we are going more and more away from the hard science, more into mysticism. But it's an interesting area.
Anything which we are not certain of the fundamental phenomena, sounds mystic, but
Correct.
it has its own science behind it.
That is true. I think that is true. And whatever else it is, it's definitely exciting.
Yes, absolutely. So, if we see this holistic version of understanding homeopathy along with different sciences and vice versa, how else can mutual gain occur in engagement?
There are some very important areas of mutual gain if the two come into interface, homeopathy and psychoanalysis. The first is the typology. Like, if the second row is of dependence and there are, let us say, X number of elements, which means there are X different types of dependencies. There may be more, but at least X number of types are there. If in psychotherapy we have not found all these types, then we can take it from there. If we have found more types than which are there in homeopathy, they can take certain things, typology. So typology is very, very important. Second, it's not necessary that we stick to the three kingdoms. Maybe a new typology can help. So
I think Jungian archetypes can also add on to this modification and creation of typology.
Yeah, there are many people who are trained in both Jungian psychology and homeopathy, and they do use Jungian typology for finding the remedy. But
makes sense.
Yeah, but if you go deeper, I mean, Jung has one particular type of typology which is useful. But like any typology, it's limited. We have to use many typologies. The three kingdom typology is a very powerful typology, but nothing is omnipotent. We always can have more typologies.
This three kingdoms sounds like neurotics and psychotics, at least two fundamental division where you can just put all the cluster of symptoms in another one and some overlap.
I mean, the classification of three, like matter, life, and mind.
Yeah.
That is one classification. We also had earlier in psychoanalysis a classification into neurosis, borderline, and psychosis. That was also the classification into three. And mild, moderate, and severe. That also was classification into three. And then people combined the neurosis, borderline, and psychosis with mild, moderate, and severe to create the intensity scale. So typology is something that, but if you go into details, for example, if you study narcissism in details, you will find many typologies of narcissistic personality disorder itself. In one of my writings, I have described collected six different types of typologies within narcissism. Okay, how narcissistic patients can themselves be subgrouped into one way, let us say, oral narcissist, anal narcissist, phallic narcissist. Second classification, say, idealistic narcissist, manipulative narcissist, amorous narcissist, and so on. So there are many different groups, typologies, and we can look at it in homeopathy and say, maybe there are more typologies in homeopathy of a particular group, and then we can learn from them, or if we have more, we can give it there, that maybe in some remedy they are hidden, or maybe the remedy is not yet found. One part. So typology. Second is measurement. Many homeopaths won't know that we already have tools in psychology to measure practically everything. You can measure anger, you can measure envy, you can measure anxiety. There are standardized scales to measure. And if there is a doubt that in the case history, I suspect envy should have been there, but it has never not come up in the narration. Then you can prescribe a envy test and measure the envy, and you can ask the question as to why this has not come up, or indirectly ask the question so it comes up. So it is a great help in knowing the full psychological picture or completing a good case history to know the measurement, standardized measurement tools that we have, which can be used there. Then in remedy selection, maybe something is, say for example, Ignitia is helping somebody, but we are not able to find why Ignitia is helping that person. But from a psychoanalytic point of view, we know the person suffered an early life object loss, and that was a traumatic event. He may not even remember it. So now we know why Ignitia works because of that early life traumatic event. Say, vertebrum album works on somebody, but he doesn't satisfy the normal criteria. Because the narcissism is unconscious. He is a covert narcissist. He lives out his narcissism by identification. On the surface is dependence. So if you this satisfies all the criteria of dependence. If you give dependence-based medication, maybe he improves and stops. And then unless you recognize the covert narcissism, one may not reach those medications which deal with grandiosity. So there, if you take some help from psychoanalysis, it helps. Because we can identify the covert narcissistic component, which is hiding behind the dependence, and behind this core narcissism is the traumatic event. Third would be to bring causality in some form to homeopathy. Now, this is something very controversial, but my feeling is it should be brought in some form. Then the idea of dream analysis. Dream analysis also is a very powerful idea which can be used because we have extensive tools and schools of dream analysis. The psychoanalytic dream analysis is far advanced than the kind of dream analysis used in homeopathy. That is where something can go from one place to another. These are some of the tools, some of the benefits that I see coming out of some sort of interface. Even explaining the periodic table and kingdoms, very important benefit using psychoanalysis.
So, Shubhasta Shigram, can homeopathy and psychotherapy healing be combined and applied by someone who is an expert in both? Is it a recommendation for the future holistic framework?
In my opinion, yes. On this point, patients are ahead of the practitioners. If you are not informing the practitioners, they already have started holistic healing.
True.
So many times it happens that we don't know that somebody is coming to therapy and also taking homeopathy, and the homeopath doesn't know he's also taking therapy.
And sometimes we send them to the homeopaths.
Yeah, I often send people to homeopaths for various reasons. It may be cost, it may be inability to participate in the method. It may be that it's too difficult for that person.
Yes.
Yeah. So I often send people to homeopathy. Many people are on both psychotherapy and homeopathy and doing very well. So it's a very good combination. On the other side, I have not seen that enthusiasm. Homeopaths rarely send somebody to psychotherapy because they believe that homeopathy addresses both the mind and the body, and ultimately no other therapy or no other modality is required. So like any other form of healing, the narcissistic omnipotence. That finally we have found one method of healing everything and nothing else is required, which is absolutely not true. In future, we will see a kind of a holistic healing framework where every modality of healing will find its place and application. So the answer is yes. Is it happening in a slow way? Yes. Can it happen to the benefit of the patients in a much larger way? yes, if we have more interface of the two disciplines and both of us leave our narcissistic omnipotence and get more into the
Also,
realistic and humble idea of integrated healing. Please go on.
so I was just adding on to that. The time has come where that integrated healing is needed because the pathologies are not just mere lifestyle driven or mind related or body related, which was in past 50 years down the lane. If you see, people would have some issues, but now as the ego strength is weakening and there is a lot of other changes which are taking place fundamentally with the body, it is the time for the integrated healers to come together and create a better framework for the pathology and the patients both.
Correct. And this becomes then the question of the next 25 years of research. The idea of the grid of holistic healing. That given patient pathology and intensity, which method to use, till how long, and how. That
Also, because like even in our healing spaces, we sometimes tend to come to certain criteria where people are to the big personality spectrum. There are different other pathologies which they have not identified, which are adding on to the existing pathology, which can be silently addressed by using other holistic methods to work upon and not bringing forth just and they're addressing just to their core issues in the first line of action, where the second line of action takes place with these different tools and different pathies to
uh,
work silently.
correct. Just take one example. In personality disorder area, we find that mostly we encounter mixed personality disorders. On the surface is something, then there is something secondary, something tertiary, and something deeply hidden. And if the deeply hidden part is what is causing much more problem than the expressed parts, then the psychoanalytic knowledge there of the experience of therapy as we find it and the tools that we have to find it out and confirm using standardized tools, that will be of great use to find out the sort of under the earth that psychological geology of that problem. That you have one layer, then the other layer, then the third layer, and so on. And which layer is best to address when. It may not be necessarily true that you straight away go to the deepest. Some will even suggest an approach of leaf to the branch to the trunk to the root and not straight to the root. The straight to the root may, in many cases, cause very high aggravation.
It also brings one of the other factors, which once I had used for one of my patients there, that there was a couple visiting for infertility issues while they have been married from last 5 years and they were planning. And the wife has undergone all the possible treatments, including pranic, tantra, and everything they have put across. But silently, on taking the in-depth history of the couple, each individually and as a couple and family, I had put husband for homeopathic treatment because there was an underlying narcissism because of which there was a secondary burnout in the female and she wasn't able to conceive, and it worked miraculously. It worked miraculously. So sometimes it's not if there is um, person who's adding on to the pathology and they are not ready to go for the therapy silently, such treatments can be offered to them.
Correct.
On the name of some kind of supplementation, and we can yield results because the triggering agents would just dissolve gradually, and the person who's actually a victim of secondary burn in a different perspective also, it can also be taken. So holistic framework just goes for the whole family.
Correct.
And the society. Not just an individual, not just the branch and the tree and the root, but rather the whole garden.
Correct. Correct.
So, sir, same way concluding with a walk into philosophy, how does the remedy, psyche, and the world relate? What's your take on that?
Yeah, it opens up a whole world of philosophical discourse. That one may think of sickness as a scream for completing oneself with the remedy.
Can you repeat that again, sir? It's something very valuable you just shared.
One view many people profess is that the sickness may be a scream for completing oneself with the remedy. That one just needs the remedy to go in to complete oneself. And because one is not complete and wants to be complete, that scream is there for completion. That may be one philosophical way of looking at it. Another way of looking at it is how the whole is related to each other and is speaking certain language. That we look at plant X and we feel essence is Y, and Y will help us to heal Z. And some other species looks at it and finds A as the essence and feels it will help us to heal B. And they may eat it for B and not necessarily for what we consume it for. We don't know how it will work out, but philosophically, it's a very fertile area. One is this whole idea of finding elemental causality and elemental design behind and below the front, which is phenomenological. How do you find design behind this phenomenological manifestation? So in that sense, the whole of all that homeopathy has found in terms of the repertory and materia medica becomes kind of data for philosophizing to finding deeper patterns of what is the design behind this phenomenology. It becomes one philosophical area. Second area becomes of that of how substances can lead to psychic states. How does the material translate into something which is of mind? That, for example, if you take an antidepressant, how does the material lead to a feeling of happiness? So in allopathy, it's very clear it's the biochemical route. Can there be some other route? So that route of action, that becomes then the question. And the third is about the releasing of healing potential by potentialization. That what exactly happens there? Why is that? How is that power released? The reconstruction of potentialization. That becomes a third philosophical important element. And the fourth is about how do you put all of this into a grand scheme of theory of everything? When you combine psychoanalysis, all that we have found in psychology, and that has been found in homeopathy, and that becomes one component of the theory of everything. Of course, it's not the whole theory of everything. We are still only at the level of mind, not at the level of life and matter. But let me say a partial theory of everything, a sectoral theory of everything. Even that is far, far away, but one piece comes in here. That the philosophizing on this interface that can provide us potentially one piece, one small piece in that sectoral theory of everything. Sectoral theory, at least in the area of psychopathology and healing. And this becomes one very important element in the larger area of the functioning of the mind. And then into the much larger area of consciousness. So this is a very rich philosophical area for those who wish to speculate. And the good part is here you are doing some sort of a database speculation. So it's more like a meta-analysis of some sort rather than pure esoteric philosophy. What we call in psychoanalysis meta-psychology. So in psychoanalysis, we have psychoanalysis, the science of psychoanalysis, the meta-psychology, and the philosophy of mind, which is really very esoteric. Like you can put a question like, why should a mind exist at all? Now that's a very philosophical, esoteric question. It's not even meta-psychological question.
True.
But life instinct and death instinct will be meta-psychological issues, meta-psychological concepts. So that way, we have a very rich area for both meta kind of speculation and a pure esoteric philosophical conceptualization, speculation, conceptualization. So it's a very rich area and also a very important area to put together a phenomenologically driven system and a causality driven system and see how that can enrich our understanding, and maybe we are able to heal better together.
Thank you so much, Dr. Vedya, for this beautiful concept of psychotherapy with homeopathy, opening up a great area for me and I'm sure for many others. See you all again. Namaste.
Namaste.